One Question is designed to give subscribers valuable insights on how executive leaders in college athletics think about key issues on their respective campuses, in their departments, or within their leagues and conferences.
Greetings, this is Ty Brown and welcome to One Question, where we highlight executive leaders in college athletics. Our guest today is Kenny Boyd. Kenny is the Senior Associate Athletics Director for Student Athlete Health and Wellness at Baylor University. Greetings, Kenny. Thanks for joining us today.
Hello, Ty. Appreciate you having me on.
Now, Kenny, your background, you were the head football athletic trainer at North Carolina. You spent some time at Texas. And overall, you got 25 years in college athletics, making sure that the health and well-being of student athletes is at the forefront of whatever institution you've worked for. And now you're at Baylor. Your role is Senior Associate Athletics Director for Student Athlete Health and Wellness. And it's been a little over a year now since you've been in that position, and the position is new to Baylor. And actually, it's relatively new throughout the college athletics industry. Can you describe the actual role that you're in, and then also why it was important for Baylor's athletic director, Mac Rose, to create that position?
Yeah, Ty, that's probably a good place to start, right? I think when you look at what we're doing now and what I've been able to do over this last year, a lot of it started with my experiences as an athletic trainer, head athletic trainer for football with UNC and Texas, and working with the people that I did at a level where a lot of it was focused not just on the medical side, but mental health and nutrition and what we're doing, how I'm collaborating with Jeff Madden, Coach Madden at Texas, with our strength coaches and how we're making sure that we're staying on top of our student athletes' care. Coming here, Mac Rhodes had the vision of bringing in somebody to help bring in those silos, right? A lot of times we find in athletics where, everybody's, head down, trying to move forward with their job and what their responsibilities are, depending on what you're doing. And I think as you start to look at it, the scope of college athletics and what we're doing now to take care of our student athletes has really evolved and to a lot of extent expanded greatly. And the NCAA with the rules deregulation on nutrition and what we can provide to our student athletes from that side, the big emphasis now that you're seeing on mental health. I mean, these are all areas that have really underlined the need to have somebody come in and help to make sure that we're all moving in the right direction. So that's my job. So here at Baylor, I'm have the direct report and those reporting directly to me for our athletic medicine, our athletic performance, which is our strength conditioning staff, sports nutrition, and then our mental health, which we added on this past year. And so it's been a great challenge, but certainly, one that I think, I've had the opportunity to have, Mac entrust in me to be able to come in, set this up the way we need to, and then move forward with new initiatives to provide more resources to our student athletes in these areas.
And those, I think it was 4 key areas you mentioned. From your experience as an athletic trainer, those are the 4 areas that I guess you believe and the industry believes constitute the health and well-being of student athletes.
I think everybody has a different way in which they look at it, right, and how they're going to define it for their institution. But at Baylor, we had a good base within our strength conditioning group and the things that were set up within that. So kind of carrying that forward to the sports science area, it's our applied performance, and what we're doing from an innovative way to advance some of the things that we're doing, not only in performance but prevention and looking at strategies for recovery. That's kind of our sports science group that works within that model. But it really takes it beyond that and how are each area communicating and collaborating together. There's a lot of things that we do together and depend on each other for the success of that return to play for that student athlete when they get injured, and what we do to prepare them for each season. And so a lot of that's already organically happening in departments, but the intention of this position allows for us to be able to set goals, set initiatives each year and make sure that we're achieving those, working at a high level. I think from this, it's like, how do you evaluate the success from that, right? And so a lot of what we're challenging ourselves to do is, we certainly have unit goals or things that we're doing within each area to improve each area, but there are some goals as a collective health and wellness team that are going to make us better as a group. And so understanding that we have to kind of put away our egos and our pride and understand that, there may be something going on in another area that I really need to support in order to make sure that we're moving collectively as a group and progressing. So measuring success can come from a lot of different ways. What are you looking at in the outcomes of some of the programs that you're doing? So if it's a prevention program, what are your injury data look like? If it's talking about education points and what you're doing to educate the student athletes, are they retaining that information? So you might want to follow up with a survey or some kind of question process to the student athletes later on in the year to see if they retain some of that information, or if you need to go back and revisit some things. Some of the things happen just as the season goes. So you may identify that with a particular team or during a particular year, there are bigger things that you need to talk about and focus on. So, part of this is a communication structure that we have too, to be able to address certain things as they pop up and realize that, hey, we might have an agenda to work on this week, but we really need to address something else because it's really resonating with our student athletes more right now. And so that's, I think measuring success is always going to be something we need to look at. It's a continual process, and how we measure our performance as a staff, but also how are we achieving our goals. It's not something that you can do once or twice a year. I think we always have to continue to challenge ourselves to do that weekly, monthly basis to make sure that we're staying on track.
Right. Now, I wonder, based on some of the things you said, the constant evaluation, you try to figure out if there's a formalized way to do it. And that's something in many parts of athletics. You try to figure out a formalized way to evaluate your success. But I wonder when you have conversations with Mac Rhodes, right, the athletics director, and you give him an update on essentially your department, the area that you lead. How is that conversation? Are there, is there an executive summary, or is there 2 or 3 things you mentioned to him in terms of giving him the updates and where we are and this is how we're successful at? How does that work?
Well, first of all, there's an open line of communication for us, on a daily basis, right? But kind of to your point, there are times where I need to be able to sit down with him and address specific things that he just needs to be aware of. And, interesting that you bring that up because that just happened today. We met as an executive staff. I'm a part of that group, and he's, allowed me to be a part of that. And so one of the things we do is there are 2 or 3 things that are key items that he and the rest of the executive staff need to know of what's going on in our area. And so, my job is to make sure that we're communicating those, but also to make sure that we're prioritizing as a group. Hey, these are the important 3 things that this week that Mac Rhodes needs to know. That's also how I want my information. So, I have my senior staff, if you will. It's our director of athletic medicine, our director of sport performance, our mental health director. They meet with me on a weekly basis, and we talk about those same things. So they're providing me a report from each area. What are the big topics that are going on in athletic medicine? And I get that report. We talk about specific things that we're doing, but they also help to communicate with me, hey, these are still things out there that we need to continue to make sure that we're addressing. So it's a good way for me to get the information, but then disseminate that information up towards the leadership to make sure that everybody that needs to know that information gets it.
And it's interesting you bring up that, thinking about this position on a grander scale, do you think this type of position will become a necessity in the future on campuses around the country? Because the influence and the importance of it sounds like it's something that should be, even looking at the direction the NCAA has gone with hiring Dr. Hainline as the chief medical officer. It sounds like this is direction that campuses will go or should go for the health and well-being of student athletes. What do you think about that?
Yeah, well, think about it, Ty. It extends beyond just some of the basic ideas. I'm the healthcare administrator. That's a responsibility that's been put on departments by the NCAA. There's a need to make sure that we are providing an independent medical care model and what we do in that respect. That's a charge by the NCAA. That's something that's out there from interdisciplinary consensus statements, and how we should protect our student athletes by making sure that our processes and organizational structure represent an independent care line. Other areas of validating, providers that are working with your student athletes from a healthcare and wellness standpoint. It could be the massage therapist, the chiropractor, the people that aren't necessarily employed by the university, but to have somebody overseeing that area to make sure that the people that are working with our student athletes are who they say they are. Their certifications have been verified, that there's background checks that are being run on them, and that we're following through not only departmental policy but university policy, NCAA conference policies. So, you really start to build out what this position looks like. You throw on top of that, I'm drug testing coordinator for the university for our athletic department, so I oversee that area too. So you really start to see where somebody that has the experience, of being in this setting, in the area of healthcare and sport performance, allows you to be able to have that sense of what's needed to create this collaborative model integrated within the athletics department and the university to be able to support the student athletes. I think moving forward, you're going to see that more. What we're seeing in college athletics play out from risk mitigation, what we have to do to make sure that our student athletes are being taken care of, and just the challenge to stay on the cutting edge. I mean, if you just take that piece in and of itself, it can be very challenging for one group, 2 or 3 people to try to take care of. So to have a position that allows you to look at that 40,000-foot view and not always have to be at the 4,000-foot view, I think is going to empower departments to work at a higher and more elite level.
Ken, this has been a great conversation. And in looking at this, thinking about the influence, the effectiveness, and the importance of the position, you almost think like, how did we exist in college athletics without it? But I guess you can say that about a lot of things, right? The cell phone, right? How do we get along without a cell phone? This sounds like something that's that important to college athletics.
Well, I don't know, Ty. I don't know that we were expecting as much out of our student athletes as we do today. I think there are some things that we've done, and their involvement is year-round. There were times when student athletes weren't on campuses, and they actually were going home. And I think the demands and the overall concern that we have on the welfare of our students on campuses in general have really increased this need. So, I think in the past what we did was we did our best to work together. And sometimes it worked. Sometimes, you had your conflicts and maybe you weren't working as well together. But the more that you see this area grow in college athletics, the more you're going to see positions like this become a part of the everyday college departments.
Right, which is only a good thing for the student athlete experience. Kenny, this has been an excellent conversation. I really appreciate you joining us here on One Question.
Thank you, Ty. I appreciate being on.
That was Kenny Boyd. He's a Senior Associate Athletics Director for Student Athlete Health and Wellness at Baylor University. And of course, this is Ty Brown with One Question. And keep in mind, the role of a leader is to create and maintain an environment that people want to be a part of. And as always, be better tomorrow than you are today. This episode of One Question is produced by Spades Media Group, solving problems using creative leadership.